Let us all welcome our speaker to discuss one of the most important issues in Saudi Arabia, and I think this is really one of the most important, the need for a unified national nursing competencies.
Assalamu alaikum, everyone. Good evening, everyone. It's very hard to talk after Dr. Ali, but before that, I would love to thank the organizing committee for this great gathering and for their kind invitation. I would love to share the screen, but if you can give me the co-host so I can share the screen with you guys.
Yes, if that would be possible, please, Dr. Nermin.
Yes, Doc, you're a co-host now.
Excellent. Is it clear to you, Dr. Benjamin and Dr. Nermin?
You can already share your screen, Doctor.
Excellent. So, as Dr. Benjamin a while ago shared, we're going to talk tonight about the need for a unified national nursing competency within the Kingdom of Saudi Arabia. So far, we have different organizations and different bodies, and I really like the presentation of Dr. Ali. He talked about the transformation a while ago. So as a kind of a transformation, and where are we going to? Still, it's like the roadmap that he shared with us a while ago. It's giving us some hope and being optimistic for the future. So for this evening, we will talk a little bit about healthcare sectors and different systems within our system. And we will talk about the Saudi Health Council, and then about Sibahi, and we will share a little bit about the competency and privilege, with the difference between them. So the objective for tonight, we're going to talk about it and understand the various healthcare sectors within the Saudi system, and then we will talk about the role of Saudi Health Council, Saudi Council for Health Specialists, and Sibahi, and then we will differentiate between competency, and we will think about and develop some kind of methodology to talk about different or W questions to understand what we are talking about in more details. So to start this presentation, let's have a quick look or a snapshot for our healthcare systems. How many different healthcare providers in Saudi? Or to paraphrase the question, how many existing health ministries in Saudi Arabia? So far, and I was doing some counting, I found 10 ministries. The Ministry of Health, it's covered around 60% of the all over healthcare services within the Saudi system. And then we have the Ministry of Defense, it's covered around 20%. All the remaining ministries are covering 20%, like Ministry of Interior and Ministry of National Guard, Ministry of Education, where most of the academic actually get treated there, and Ministry of Human Resources, mainly for elderly people, and also King Faisal. It is one of the most pioneer hospital in Saudi, and also John Hopkins in Aramco, Royal Commission in Jubail and Yumba, and private sector. So far, if we do the math, we found 10 different healthcare providers in Saudi. And who organized those different sectors? To make the organization right, then the Saudi government have created another, I'm not going to call it another ministry, which is number 11, but we're going to call it Saudi Health Council. This is the Saudi Health Council. And also we have the Saudi Commission for Health Specialists, plus Sibahi, which is known for, well known for the people. Saudi Health Council established regulation that ensure coordination and integration among these different healthcare or different stakeholders. Saudi Central Board for Accreditation, Sibahi, to support all healthcare facilities through accreditation to comply with the quality and patient safety standards. And then we have the Saudi Commission for Health Specialists, responsible for supporting and evaluating training programs, as well as setting the control and the standard for practice of health profession. And under the Saudi Commission, we have different association, like the Saudi Nurses Association, which is coming under the Saudi Commission for Health Specialists. A study has been done in 2017. It's a little bit old, but now situation is much better. It's done by Sibahi, actually. They done this study among all 448 hospitals within different sectors, which the 10 sectors that I mentioned a while ago. They found, unfortunately, almost half of these organizations, they don't have good compliance strategy for credentialing, and almost 45.3. And also overall, the compliance for the privileging was 50%. That's almost half. So this was shocking for us, but now the situation is much better with the transformation going on. So how we can differentiate between competency and privileges? Mainly, this is the some definitions. In a special privilege, for example, the way I look from practice point of view, mainly it's for physicians. Competency for other health allies. However, once we have a nurse practitioner, Prince Noura, for example, in Riyadh here, they started this program. In United States, for example, they started something they call it physician assistants, where they give the nurses some privilege to do, and that will for the sake of cost effectiveness. Now nurses are getting more specialized, as Dr. Abdurrahman mentioned a while ago. So we have different specialties. So we're going slowly to have some privileges, but so far, from let's say legal point of view, we have competences. So the privilege, the definition is a special right, advantage, or immunity granted to a practical person or groups. If we apply this in reality, this is mainly for physicians or different, let's say RT, for example. They are privileged to do certain tasks. Permission granted by hospital or other healthcare institution to a physician or other provider to do specific diagnostic or therapeutic services. Where competences, or being a competent, that means is the mastery of certain skill or ability, which is the outcome. And usually it's coming from the person, what he studied or what was his back. In this situation, we apply it to nursing. It's around about achievement or competences. So mainly the integration of knowledge, skill, attitude, and the ability to and expected required for the nurses in their practice setting. And in different hospitals or different sectors or different units, let's say, each specialty, they have different competencies. In our hospital, for example, in Ministry of Defense, we have general competency and we have unit-specific competency, where is the competencies for the nurses who are working in ICU, they're totally different than the people working in emergency, and so on. So to go and think more deeply about this variation in among different sectors, I developed this kind of questions, W question, what and why and where and how and when. These questions help me sometimes to think clearly. So what we need national nursing competency. So if I work in hospital A and I transfer to hospital B, I didn't need to go through orientation program and learn a new competencies if things are unified. What in NNC? NNC can be described as a while ago. We grabbed the definition, terminology is knowledge, skill, and attitude. What's the KSA? Defining the profession and its scope of a practice. So if, let's say, if we have agreed in certain or general competencies for the nursing, they have to be, let's say, communication, for example, infection control. These things are expected to practice in every single institution within the kingdom, setting education standard and the standard of ethical and competent practice, establishing system of accountability and credentialing process. So this is just to help me to think and organize some thought around this topic. Now, to go deeply, I really advise everyone, if this is going to be the Brody theory, it has been, I think, in 1981 or 1982, to be exact, he came up with a methodology with 5 steps. If you find any issue within your environment, work environment, or within your family, if you apply this system, definitely you will get some answer and help you to be a problem solver. So according to Brody, what's the problem? Before we start and digging further and to know what's the root of the problem, we have to admit, we have to realize that there is a dilemma exists. If there is no dilemma, so you don't need to continue in these other 4 steps. So once we admit that there is an issue, so we have to understand it and identify what's the real problem. In this situation, I say we need a unified national competency. Then clearly, who are involved in this problem or in this dilemma? And let's say maybe Saudi Council, maybe Minister of Health, maybe our beloved Saudi Nurses Association. So we have to put those people who are involved in solving this issue in the same page. Then we have to think about alternative solution, because in his postmodern methodology, he actually think that there is more than 1,000 solutions for a problem. So definitely, if you think about the problem, you will get problems. However, he is postmodern, so he think alternative solution. One of these solutions maybe start gradually to solve this. Maybe start with the general competency, and then we go deep and until we find the specific or unit specific competency. After you're gonna throw this model or these 5 steps, then you have to seek some help from the consultant people, from the academia, from the people in leadership and these things to choose from one of these alternative solutions. So this is if this is slide only the take home message, I really advise you to go and read about his theory. Next, let's go. Then Binar theory, I had the privilege to meet her before she died. She died in 2019, I think in April. She developed this theory in a practice from novice to expert. And according to her, that's once we are fresh or newly graduated, we become like a beginner, and then we become competent until we reach a level where we are proficient. And with time, with the practice, you become expert in your certain specialty. So this is another theory. This is actually one of the nursing theory that has been around for a few years. And then I want to share with you, this is a study done by some of our colleagues, and I was participant with them when we did this study. It's called Triple B's and C's. Actually, if we think about competency, it's not something that we can give it directly. It's becoming from the curriculum itself. So let's think about the preceptee, which are the student with an internship or a newly joined our organization. They are still considered as a preceptee. If there is a policy govern the preceptee and the preceptors who are teaching them, which is mainly the nursing profession, actually it's we actually, I'm proud to have certain preceptors who are still around, and we meet, and now we are working as a colleague, but they were mastering this skill before me. So I learned from them a lot of things. So if the preceptee gonna through a good curriculum from good university, the kind of relationship between the receptee and their preceptors is cooperation things, cooperation methodology. So they will learn from each other, and also the preceptor themselves. They have to go through courses to tell them or to teach them how to teach. So there are some preceptorships course. So this is another theory that I just wanna. I thought it's wonderful to share it with you. Now we moved from what to why. Why we need this competency? Is it important? So competency. This is in the left side. You see the facts, and this is the rule. Competency are costly, and non-compliance for these competency are risky. It is very risky. It might lead to patient die. So what's the rule here? Cost effectiveness, based evidence actually supporting all this competency. So whether it's costly, but we have to do it. Let's go to fact number 2. Knowledge is rapidly updated. In every now and then we have a new knowledge, we have a new theories. So we have to keep up with the standard. For example, the rule is the standard of today. It could change tomorrow, and all of you are gonna through certain things in your lifespan, or let's say aspirin, for example. It has some research they support this. Some research are actually saying it's not healthy. But I remember that time when I graduate, we used to do things that it's actually not permitted to be done today. Moving to fact number 3, there are general and unit-specific competency. Unfortunately, up to date, few countries have national competency standard. Some of the Western countries, they don't have even national competency level. Moving to fact number 4, and this is a very critical thing. An assessment through theoretical and practical exam. Unfortunately, we've seen some, it's not objective, it's subjective. When we talk about subjective, that it might affect the reliability and the validity of those candidates. And that will lead to a disaster in the practice area, especially for the people who are working in a critical area. I want to do a quick exercise with you guys. And this is actually a real exercise. We just recruited 50 nurses. And those, if you have a pen, you can use your pen. Or if you want to just listen and see the slide, that's okay as well. We recruited 50 nurses, and we were actually giving the privilege to give them 15 competency. So 50 staff. We need for each competency to be mastered at least 1 day. That's meaning in our hours, that means 12 hours. So we spend 9,000 hours to teach them these, or to make sure they are competent within only 15 competencies. So to cover the shortage from their area, we actually call for another 50 nurses to cover them in the area, because they are already taking from their areas to be with us in the education side. And this is another 9,000 hours. Our system here in Saudi, we are following the Ministry of Labor. Each overtime actually is we multiply it by 1.5. So that's mean more hours. Also, we need a CRN, which is needed to teach those 50 nurses. We at that time, I think we required 8 to teach 50 nurses. So clinical resources nurses were there, where they were 8. They were occupied all the time. So we spent another 1,440 hours. So let's see the cost in all over, what the cost. So we added actually 9,000 hours plus 13,500 plus 1,440 for the clinical resources nurses. We end up with 23,940. That's almost 24,000 hours. Let's say the hour is costing us 100 riyal. This is 2 million riyal only to do 15 competency. It is very costly. So we paid the 3 times. We paid for the staff who are covering them, and for the CRM. So this was costly, but actually, for the sake of patient safety, we still doing it up to date. Now, who are the responsible for this? I'm really glad that some members from the Saudi Nurses Association are here, so at least they can share the responsibility with us. Saudi Commission also, they are on board. Saudi Health Council, I would love their participant in this to create national competency. Sibahi, now the fourth standard, not released yet, but they added a lot of privilege for nurses, and it is a standard now nowadays. So far, these are the things that I would love to share with you, and also small notes here for King Faisal University. I saw it at Department of Nursing. I would love at the end of this conference, at least to write a recommendation to make it a College of Nursing. So if we empower our students, empower our nurses, empower our academia, empower the profession, the whole healthcare sector will be improved. I really admire the talk of Dr. Abdulrahman, who is the dean, and he said that the nurses are the backbone. He's truly right, and we would love to make that in a practice and start from King Faisal and change the word of department to make it a college, separate college, like College of Medicine, College of Pharmacy. Here in King Saud University, it's already separated. Once again, thank you very much for attending and listening for this thoughts, and hopefully if there is any question, I'll be around.
Thank you, Doctor. Thank you so much for your wonderful presentation. And we really learned a lot. And I think one of the points that I really liked about your presentation, Doctor, is when you said that learning is a two-way process. We learn from our colleagues also, and our colleagues learn from us also, so that cooperation is always needed.
Like an area that needs to be changed. So that's actually something that I appreciate, because even in a human being or a nurse who wants to progress in their own careers, they really need to have that acceptance that there is really something that they need to change within themselves. So this is the same as with our profession. I mean, we really need to recognize the areas that we need to improve. And in that way, and really looking at that lens, there will be open channels for more communication, more dialogue, and more opportunities for transformation.